What happens to your body when you stop smoking? Smoking is one of the leading causes of preventable deaths around the world, because it releases more than 7,000 chemicals every time you light a cigarette. But with 1.3 billion people actively smoking, what actually happens when you stop smoking? Let's understand what will happen once you start to quit smoking. In the first 20 minutes after quitting, your blood pressure and heart rate will return to normal. This is because the nicotine in cigarettes releases epinephrine and norepinephrine, which increase your heart rate and narrow your blood vessels. In addition, these effects cause smokers' extremities to feel colder, but by now your hands and feet are back to normal. It only takes 2 hours for the nicotine cravings to kick in, resulting in moodiness, drowsiness, tense feelings, and even difficulty sleeping. Because nicotine also releases more dopamine than normal, these are expected physiological responses to the decrease in its release. 8 hours after quitting, the inhaled carbon monoxide clears, allowing oxygen levels in the bloodstream to return to normal. Carbon monoxide and oxygen compete to bind to hemoglobin in your blood, stressing the circulatory system. So as it clears, there's more room for oxygen. However, for long-term smokers, this carbon monoxide exposure causes red blood cells to increase in size, making the blood thicker, and causing higher blood pressure and increased chances of developing blood clots. Surprisingly, 24 hours after quitting, coughing will actually increase, which is your body's way of clearing out all the toxins from the lungs. Additionally, at this point, the risk of developing various coronary artery diseases decreases, all within 24 hours. After 48 hours, when nicotine and its metabolites are completely eliminated from your body, damaged nerve endings begin to regrow. The tar and other chemicals in cigarettes leave for fewer taste buds that are flatter with less blood vessels. They now begin to regain their sensitivity, making food taste better. Although chronic smokers may often have irreversibly damaged taste buds at the 72-hour mark, nicotine withdrawal peaks with headaches, nausea, and cramps, as well as emotional symptoms like anxiety and depression. These symptoms can be seen by most addictive substances, including caffeine, but after this period, the worst is officially over. After 1 month, the risk of developing type 2 diabetes, cancer, and cardiovascular diseases has already decreased. After 9 months, the damaged cilia in the lungs are almost completely repaired, which are hair-like structures that sweep away dust and debris, and symptoms such as coughing and shortness of breath are almost completely eliminated. And around 1 year, the risk of developing heart disease as a direct result of atheroma formation, which are deposits of fatty material or scar tissue from deteriorating arterial walls, decreases by almost 1/2. In 10 years, the chance of developing lung cancer decreases to half that of someone who did not quit smoking. And in 15 years' time, the risk of heart attack decreases to the same as someone who has never smoked their entire life. Of course, this guideline is not definitive, and the average amount you smoke per day or year will play a role in how well your body recovers. Unfortunately, there will always be some irreversible damage to the lungs and increased susceptibility to developing various lung diseases. And while quitting may be difficult, the benefits greatly outweigh the initial withdrawal. Ultimately, the best way to prevent this from happening is to not begin smoking at all. Smoking is one of the bad habits that every person should avoid. So start by taking care of your health and stop smoking for long-term good health. If you enjoyed the video, make sure to like this video and subscribe for more content like these. Thanks for watching.